All right, we're live.
All right.
Live.
See, I wonder how. I know it takes a few seconds. Seems like it takes a few
10.
more seconds.
It takes 10 seconds to load up.
And to go to
Out.
and to say it's us.
Yes.
Ah, there we go. And you are correct, sir.
Dr. Clothier, for a moment you look like petrified wood.
Yeah, it's kind of sad. You age poorly when you start to petrify. I've always told people that.
You are a wise doctor.
Is that one of your big medical tidbits you give to them?
I have to have that talk with people, and it's just one of those things.
Oh, that's funny.
Don't become like the rock forest.
Have you ever been to the petrified forest, Dr. Clothier?
I have, but I was only about 5 years old. I still remember it, though. It's fascinating.
That's one of those things that would
I've
stick
always
in your
thought that
mind.
process is incredible.
Hey, Dr. Clothier, I've got, I do a nebulizer at home. I just saw on Groupon the other day, boy, they know their target audience as far as what I search for. It's a mini handheld nebulizer for your albuterol. Do those work as well as a regular big old nebulizer?
I don't think you get quite as much power as what I've heard from people.
Okay, that's what I wondered.
It's adequate. It's not a replacement yet. I think the technology will get there as things get smaller and more efficient, but I don't think it's quite there yet.
I wanted to ask you that before I even looked at it, because it's like super duper on sale. Obviously my nebulizer was paid for by insurance, but I was like, that's too good to be true. It's so small. It looks like a breast pump. I mean, it literally looks like a handheld breast pump. And I'm like, I just wonder, does it penetrate as deeply as into your lungs as with that little suction thing?
I don't think you'd find it as satisfactory in terms of breathing relief yet.
Okay.
I think another couple of years the technology will catch up there too, probably, but it's just not quite there.
I just
everything
seeing it on Groupon,
smaller, more efficient, and better.
Yeah, and I mean, you're probably right. Eventually, you'll get there. But yeah, it's funny because I was looking at them like, if it's on Groupon, I don't like the same place I've bought eyeshadow on sale. For some reason, I was like, yeah, I think I'm gonna ask Dr. Clothier about that one before I even bring it up to my regular doctor.
My observation, the seller with Groupon is always kind of bitter toward the person that does the Groupon. It's kind of like you go for your group activity on Groupon. They're like, oh, you're the Groupon people.
Oh, that's you.
And I was saying, well, at least we're here. Nobody else here. It's kind of an interesting conundrum, I think.
Coffee.
Yeah, pass some through the camera.
I know, yeah. Do you need some for all your meetings today, too?
Oh, man. Mondays are busy days.
Oh, and only probably getting busier. The season is up on us. Oh, tis up on us. Well, good morning to the crew. Happy Monday. And we're official. We have coffee. We have Dr. Clothier. We've got JP. We've got Charles.
I was about to...
Live from VentureX Studios, it's JP.
Good practice.
And the crew.
I thought we were way ahead of the game on that. Murphy's Law Monday.
No, I've just completely forgotten. I'm hopped up on breathing medication, so I'm like, oh, yeah, that's right. The official intro.
Okay, Dr. Clothier, you just need to leave your notes, and I need to leave my notes, and we can just go ahead and go have coffee.
He's
well,
like, okay.
She already confessed to being on drugs.
I'm on the breathing medication.
The problem is the first step.
Well, and let's talk about that for a moment, shall we? Admitting to the problem. We watched Dak Prescott go down, and we watched his ankle do what it did. And it's funny, I've got an athletic training friend of mine from SMU, went on a full ride scholarship there. And he said, I knew it was dislocated and fractured because his toes went to the south and his ankle went to the west, I think. And he says that doesn't happen normally, or whatever direction he gave me.
Yeah, you don't necessarily need a full scholarship to know that. That's true.
It looked
I'm happy
bad.
you have one. I think that's good.
But speaking of that, though, and admitting to it, do we have the right surgical advances now where we can put him back on the field at some point?
Well, yeah, I mean, to answer that, he'll be back on the field at some point, no doubt. But the difference is, if you remember a few years ago, and I know you followed sports for years, and I think most people would identify this, we used to see people with injuries, and there was always this talk of, oh, in a week or 2 weeks when the swelling goes down, we're going to operate and get him fixed. And, it'd be,
good point.
Then he'll be off his feet. Maybe if it was either, whether it's a hip, like the Alabama quarterback a couple of years ago, or Dak's ankle, or someone's knee, Klay Thompson's knee, say, for instance, with the Golden State Warriors.
Right.
When the injuries happened in the past, we used to always talk about get the swelling down, slow recovery, in bed for a while. Maybe even your grandmother had a hip replaced, and you remember her kind of laying around for a while before she got up gradually to wheelchair, then crutches. Well, the difference now is almost immediate surgery, and that's what Dak went into surgery within hours of the injury, and I can tell you that ankle would have been extremely swollen from that injury. I mean, that's just a bad injury, and the fact they repaired it quickly is the new modern science. And I want to address a couple of those things, because those are things people intersect with fairly often. Is we used to, again, wait for swelling to go down. Now what's been shown is that infection will set in, where that blood makes sort of like a perfect little culture plate for infection. And, infection is the great enemy of any surgical procedure. So if you can avoid infection, operate early, and get the repair done, and then deal with all the infection risk, then you're better off than waiting. And it's interesting that I think it was Saturday, a report came out that Dak is doing well with no infection. If you heard that little phrase in there about no infection, that's just huge. If you have followed Alex Smith's recovery with the Washington football team quarterback guy, he had a bad infection. I think he ended up having about 17 surgeries, almost lost the leg to infection. And that doesn't mean antibiotics aren't good, doesn't mean doctors aren't good, doesn't mean the hospital isn't good. It's just you run a risk when you have open tissue of a significant infection. So thankfully, for Dak's sake, he was operated on quickly. And that's what happens now. If you have a hip replacement, you don't sit around for a few days. If you have a knee replacement, you don't sit around for a few days. You get up and walk usually the same day as the surgery. And I think that kind of shocks people. I hear people come back and say, oh, I had this knee replaced and they made me get up that first day. But, 4 weeks into it, they're walking into my office doing pretty well. So we've learned a lot about recovery. Instead of waiting for the tissue to kind of beg us to get there and repair it, the best thing to do is get in there, repair it, and then recover. So that's a pretty significant difference in athletes and non-athletes in terms of joint injuries and replacements and such.
So, Dr. Clothier, what created the ability to mainstream? I mean, I don't even know if that's a good word to use in medicine, but to be able to mainstream people into surgery that quickly, what was the big change in the medical field? Was it a mindset? What was it?
Yeah, it's just technology and a mindset. We always continue to learn in medicine. There's always research, and that's one reason, for instance, with COVID, we don't have the answers all in front of us because there's research going on. And, that's still true of, there are new approaches to hypertension, there are new approaches to diabetes, to asthma, all kinds of things, certainly to cancers. There's almost always a newer treatment that's being tried. And I'll tell you a big difference, for instance, in breast cancer treatment is now there's often, rather than immediate surgery, it's sort of the opposite. There would be a chemotherapy done first to shrink the tumor, to minimize the tumor, and then do a surgery. And all that's based on evidence-based outcomes, research, better technology. I think it's interesting, about 5-10 years ago, there was all this talk about minimally invasive surgery. Every surgery I know of has always been minimally invasive. Nobody ever wants to open a wound more than is necessary.
Right.
But the talk became minimally invasive because, that was sort of a marketing ploy. But part of that was instruments are smaller, robotics are involved. Less manipulation of the tissue means less irritation to the tissue, and therefore better recovery.
Which is amazing, Dr. Clothier.
True over time, and there are all kinds of advances you would never even necessarily hear about unless you're in medicine. But like the way wounds are irrigated during surgery.
Wow.
Sometimes antibiotics are placed into a wound so that they'll, reduce the risk of that infection. Sometimes numbing medicine is placed into a wound so that people won't hurt as much, so that they are able to get up and move more quickly and be able to recover more quickly. So all that's just technology and experience and research, and that's why we need big research studies, big research institutions, all kinds of things that help us on a day-to-day basis.
Well, and also, Dr. Clothier, you're talking about like arthroscopic. I know my knee, when I had surgery on it, was done arthroscopically, and they had said literally just a few years before I would have been, had at least, probably a 6 to 12 inch incision over the top of my kneecap. So instead I had 4 little holes, same result with surgery. You think about like robotics. I had a family member who had kidney cancer, and as a result, literally there's not even like a need for stitches. They just kind of do like some kind of a surgical tape on the holes.
Yeah,
they
it's
open,
amazing.
and you remove an entire tumor, a small portion of the kidney, all with robotic arthroscopics. That's amazing.
Well, you basically keep the hands out. People's hands are the large piece of a surgery frequently.
Right.
And if the surgeon's hands don't have to be in there, and if you can guide equipment robotically, then, it is, it's just a tremendous benefit. Again, the more you get in and out and you don't manipulate tissue, the better the surgery. And I tend to see surgeons' outcomes. That's a medically relevant issue for referring people, for instance, to surgeons. And the better outcomes are those who are just really good with their hands, whether that's an open surgery, an arthroscopy, or a robotic surgery. Those who are really good at getting in there, fix it, get out, do very well. The ones that have longer term or longer duration surgeries and challenges getting in and out, the more time you manipulate tissue, the more challenging it is to recover.
So, Dr. Clothier,
that's where experience plays a role too.
Let's shift for a moment over to COVID-19. So the word is coming out, and I spoke with a person that is a friend of mine that runs an emergency room up at Texoma Medical. They are packed. He was looking for hospital beds all over Dallas-Fort Worth, and people are now being staged in the standalone ERs. What can people do to stage their home to almost model a hospital room to get ready to go to a hospital?
Sure, that's a really good question, because the majority of people don't need to be in the hospital. And I think 2 things need to be considered. One is, if you are short of breath, you do need the hospital. And we're talking like people who cannot complete sentences. We're not talking about like, when I run upstairs this week compared to last week, it takes me a couple extra breaths to recover. We're talking about profoundly short of breath, need to be at the hospital, or a high fever, or other, like, being disoriented, some combination of fever, shortness of breath, and challenge. And those people need to be at the ER and potentially admitted to the hospital. If you just are sick, and I don't mean to make light of it, but if you have body aches and a fever, but you're breathing and you think you have COVID, you really don't need to be in the ER, and you don't need to be in the hospital. So what you need to do is have a place in your home where you can self-quarantine. You need somebody to check on you, maybe is the most important. Make sure that you're doing okay. You need, obviously, food, water, and you should use a bathroom that nobody else is using, and a bedroom that nobody else is using. So that you can be contained in that area and try to minimize the risk of infection. What you don't need to do, honestly, is go out and, go to an urgent care, a doctor's office, or a hospital if you have manageable symptoms like that. Because even if you have COVID, if you test positive, there's nothing you can do about that. It's a virus. You just need to ride through it and recover. Now, again, if you're critically ill, that's a very different issue, obviously. But we could minimize the overrun of the hospital, the ER, the standalone facility, if people would self-quarantine when they feel they're sick and be honest about it. don't pretend you're well and go infect a bunch of family members or coworkers. And so I do think the self-quarantine is a very important thing. You know, at our office, we screen people, and if they sound like they have COVID, like, you know, loss of taste, loss of smell, fever, but they're breathing okay and they're coping, we encourage them, instead of coming in, go home and self-quarantine. Because, you know, no amount of analyzing that person saying, oh, yeah, you know, it's probably COVID, that doesn't help you recover. And if they are sick, you know, if they are short of breath, severe body aches, if there's any degree of disorientation or inability to take care mostly of themselves, then absolutely we send them to the hospital. So that's a, you know, I think a very important triaging based on symptoms.
Well, I
think, unfortunately, going into the fall, we seem to have a little bit more of the tendency to think, oh, you know, I'm sick, I got to go, you know, get that test, whatever. There is a role for testing, and some employers are requiring it. But a lot of that can be done as an outpatient drive-through testing facility rather than an ER or a standalone urgent care type center.
Well, I know that we are upon the 7:54 hour, and we got you running a little bit late this morning. We were running a little late this morning, getting everything up and going, and we don't want to eat up any more of your time, so I know you got to get out of here, but thank you, Dr. Clothier, as usual.
Yes, thank you so much.
Certainly. And next week, I do want to share some outdoor activity in terms of what you can do to help keep yourself from going nuts by being closed in too much.
Oh, amen.
Some of the classic things that you can get out and do. They're easy and refreshing and good for your health, good for your brain, good for the body, and all that. So have a great week.
Can't wait.
You as well.
Thank you. Be blessed.
Thank you, Dr. Clothier. Be blessed.
Thank you.
All right, Dr. Norm Clothier with Family Healthcare Associates.
Always great information.
Family healthcare we need.
And you know, that's so interesting, JP. You know, we had asked him specifically to talk about. We could use a whole hour with Dr. Clothier, but we had asked him specifically to talk about Dak Prescott because, you know, and so many of us look back and think of the Joe Theismann injury, and you're like, oh, that's it. You know, most people on social media after the game where Dak had his injury were saying, yep. That's the end of his career. Wow, everybody was upset. He's right. Usually it would have been, he would just now be getting ready to go in for surgery somewhere here 2 weeks later. And I didn't even think about that. So that being able to immediately repair what needs to be repaired probably does make all the difference in the world. There are a lot of advances, and we just kind of take them for granted. You know, especially when you see something like you said, toes are going one way, heels going another way, ankle bone is not connected to the leg bone or whatever. It is amazing how far we've come in the medical sciences. So, that's incredible.
I knew we had limited time with Dr. Clothier, and I wanted to get out the COVID-19 because hospitals are massively running in huge numbers right now in the Dallas-Fort Worth area, and I know that they are packed. And like I said, Dr. Dave was calling around trying to find a hospital, and so I wanted to get to that. But one of the things I wanted to mention about surgeries being able to be so much faster as well is the fact that there are a lot of clinics now or doctors' offices that do day patient surgeries. I think we do more day patient surgeries today than we've ever done.
Well, and again, things that are done as day surgery that before you were in the hospital 2, 3, 4, 5 days. Heck, even childbirth. I mean, you used to be in the hospital for almost a week. I wonder if Cleo's on the feed, and she could probably tell us the history of that. And nowadays, unless you had some kind of a complication, you're in and out in less than 48 hours. I mean, they get you in, they get you out, kind of like drive-through service. It's so for one thing, I think it's a lot more to be said, and then this also ties into what he said about COVID and something I didn't know. But I think it is important. I think you do better if you recover at home from surgery, illness, whatever, because if you're surrounded by your loved ones and your family and the things you love, you know, and you hold dear in your home, I think that's a better place emotionally. And we know that emotions and the mental health has so much to do with it. You know what I didn't even think of until he said it, and it makes perfect sense. Don't share a bathroom with your loved one during COVID. If one of you has COVID, didn't even think about that. I thought, well, shower, you're washing everything down, rinsing everything off. Especially if it's a husband and wife, you've usually got 2 separate sinks that you brush your teeth in. He's saying, no, go somebody shower somewhere else, use the restroom somewhere else. I didn't know. I learned something new every time Dr. Clothier's on.
So, Gail asks the question, you go and you get tested 2-3 days later, you get your test results and it's negative. So then you're not getting treated for what you were really sick for, which could have been pneumonia or it could have been the flu or what have you, because Gail had that, right?
Oh,
she experienced that with her doctor.
Yes.
And so my response...
And she wasn't even on antibiotics.
Right.
I mean, it was like she could have really fallen really ill.
Yeah. Bronchitis,
waiting.
and she's normal. She's used to having bronchitis during that time.
Right.
I can't answer for Dr. Clothier. We'll have to ask him next week what he thinks of that. In fact, I think we did, and Dr. Clothier didn't agree with the physician. In fact, we did ask, because when it was happening, I asked him, and he said that the doctor should have taken better care of getting your symptoms. So, and what Dr. Clothier had said was that when you lose taste, lose smell, when you have the majority of them. Now, I don't know that I've never heard of anybody losing taste or smell with bronchitis or with pneumonia.
No.
So maybe that's an indicator.
Well, your senses are dulled when you've got, and you don't feel like eating, and nothing tastes good. You can't breathe very well with bronchitis and pneumonia as somebody who gets both of those on a fairly regular basis. But you still have, because you can taste like the sinus taste in your mouth and stuff.
Right.
With COVID, I mean, and I don't know, JP, if you know this or if anybody else who's experienced COVID or has a loved one who has, it's like you can't smell anything or taste anything at all. There's nothing.
Right. I agree. Yeah. Oh, yeah, absolutely. Hey, Charles, let me try to switch your app
and
on.
That's just COVID specific, right?
0.124. Yes, that is correct.
So I think that's just a COVID specific thing.
Now, of course, unless you're my dad, then you can't smell because he had a head injury in college.
Yeah, that's crazy. Yeah.
Yeah. So I'm going to try to see if we can switch your app to work. I'm going to bring up a graph of the United States in regards to COVID-19. And I love these graphs because these graphs not working this morning. Okay. So the graphs are amazing because they give you a day by day once you put a highlight over it. And I just typed in U.S. COVID-19 deaths daily change is what I clicked in. And the graph is amazing. So on June the 14th, and what this graph does is it tells us